with this pandemic. If you go to PubMed, which is one of the main search engines to find peer-reviewed scientific medical articles, you will see over 100,000 articles on just COVID-19. So you go on PubMed, you type in COVID-19, you see over 100,000 peer-reviewed scientific articles, okay? Now, if you were to just base off kind of what we're hearing in the media and from our leaders, you would get the impression that perhaps all 100% of all these articles is talking about mass medications, vaccines, and lockdowns. Right? That's the impression that you would get if you're just basing off what we're hearing from the media. But the question is, are there people with impeccable credentials publishing in peer-reviewed journals, credible journals, writing about other things other than mass meds, vaccines, and lockdowns? That is the question. Specifically, are there people with very good credentials publishing in peer-reviewed journals talking about the importance of lifestyle and how it could potentially help with dealing with this pandemic? And what I want to argue today is that indeed there's a good amount of research and published papers coming out on the impact of diet, exercise, sleep, and so forth, and how these things can be potentially beneficial for dealing with the current pandemic. But we are not hearing from it, and the public is not really getting that information because the public is not going to go out of the way to research PubMed, right? So our goal is to kind of shed a little bit of light on what we're finding in the scientific literature, okay? So let's begin. Let's begin with someone who is the editor-in-chief of one of the world's most prestigious medical journals, The Lancet. This is Dr. Richard Horton. Dr. Richard Horton is the editor-in-chief of Lancet, and he wrote a little paper, a commentary, published in The Lancet, and I want you to notice what he says here. He says, "We must confront the fact that we are taking a far too narrow approach to managing this outbreak of a new coronavirus." So what's he saying? We're taking a far too narrow approach. Okay, this is Dr. Richard Horton. This is not a conspiracy theorist. Okay. The science that has guided governments has been driven mostly by epidemic modelers and infectious disease specialists, who understandably framed the present health emergency in centuries-old terms of plague. But what we have learned so far tells us that the story of COVID-19 is not so simple. Very interesting. Okay, so basically what he's saying is that because the coronavirus is an infectious disease, we pretty much shipped off the responsibility of telling us what to do to people who specialize in infectious diseases. Okay, but the result has been perhaps a too narrow approach to understanding this pandemic. That's what he's essentially saying. Okay, then look here. Two categories of disease are interacting within specific populations: infection with severe acute respiratory syndrome coronavirus, so that's coronavirus, and an array of non-communicable diseases. Very fascinating. So he's saying that it's not just one disease that is manifesting itself, it's the combination of two kinds of diseases, okay? Then he says, addressing COVID-19 means addressing hypertension, obesity, diabetes, cardiovascular, and chronic respiratory diseases, and cancer. Is that interesting? Okay, how many of us are hearing this in the news? Not too often. Okay, he says addressing COVID-19 means you have to address these chronic diseases. Then he says COVID-19 is not a pandemic, it is a syndemic. Okay, Now, I think he's kind of overstating his case. I think it is a pandemic, but in any case, he is. I think he is accurate to characterize this also as a syndemic. All right, so you're probably wondering what the heck is a syndemic. We'll get to that. But basically, his point is very simple. Just if you listen to what's happening, listen to what the media is telling you, pretty much the idea that we get is that people are getting infected with this virus, they're getting sick, then some people are getting severely sick, and then there's some people who are dying. And this is pretty much the situation as we're being portrayed to from the media. Okay. But what he is saying is that it's actually not just like this, it's more like this. It's a syndemic. Basically, what a syndemic means is you got different diseases having a synergistic effect to create a massive effect. That's what a syndemic is. So it's not just coronavirus, it's coronavirus interacting with all these other chronic diseases that's driving the pandemic that we're seeing today. Okay, I hope that makes sense. All right, so it's more than just this virus that's infecting us and making us sick and causing people to die. Okay, it's interacting within an environment that's conducive for it to become severe. Okay. Now it's not only Dr. Horton. Okay, this is Dr. Padmanabhan, MD, PhD. Okay, he's writing here. He says the COVID-19 pandemic has become an extreme form of syndemic, a pan-syndemic. Okay, this is Paul Griffiths, Emeritus Professor of Virology, University College London. Okay, COVID-19 should thus be thought of as a multifactorial syndemic caused by contributions from multiple overlapping epidemics. So again, you see different voices describing COVID-19 as a syndemic, different diseases coming together, having a synergistic effect to create a massive effect. That is what we're seeing today with COVID-19. Okay, so the evidence is really clear. Chronic diseases greatly increases the risk of severe COVID. Okay, when you look at the research that's coming out as they're looking into COVID-19, this is extremely clear. People who have heart disease, hypertension, diabetes, obesity, these individuals are at greater risk of advancing to severe and mortal COVID if they get infected with the virus. Okay. So now the question is why and how? Okay, like what is it about these diseases that makes somebody more prone to advancing to a severe form of COVID-19? Okay, well, this is Dr. Yu, and he writes, in severe cases of COVID-19, the SARS-CoV-2 virus infection does not account for the severity of the disease. Now you're probably scratching your head, right? Because like, well, I thought it was the virus that's would make the disease more severe. But here he's saying it's not. Now, of course, let me just pause and say, the virus obviously is the initial factor. Of course, yes, right? But he's saying there's more to the picture than just the virus because I think people get the impression that the virus is like a Pac-Man. When it enters your body, it just starts eating up your cells, and it starts eating up your lung cells, and you just die, right? I think that's the impression that many people might get of what this virus is doing, but that's actually not the case. All right. Now, can the virus damage your cells? Of course, yes, but there's much more to the picture than that. And when you understand what's actually going on, it helps you understand why lifestyle is so important. So let's take a look. Okay. He continues. It is the cytokine storm or the uncontrolled release of cytokines to the infected cells by the immune system of patients, which causes hyperinflammation, collapses the respiratory system, and kills the patient. So notice what he's saying here. He's saying it's not so much the virus itself, it's the cytokine storm that is the result that happens after infection that actually causes the death. So we have to understand what in the world is cytokine storm. Okay, so what is cytokine storm? Well, if you get infected with a virus or a bacteria or whatever, okay, an immune cell is going to detect it. Okay, and that immune cell is going to start releasing what are called cytokines. Okay, cytokines, you can understand them as simply messengers. Okay, is basically this cell, your immune cell, is sending messengers to other immune cells to get into the fight. It's like recruiting soldiers to get into the fight. Okay, now as you could imagine with the name cytokine storm, it means there's a lot of cytokines. Okay, so basically what's happening is people are getting infected with coronavirus, and then there's a massive release of cytokines, all right, which mobilizes a massive number of immune cells. And basically, if you look at the literature there, the peer-reviewed published literature, it's very clear that cytokine storm is one of the main drivers that that brings people towards severe and mortal COVID. Okay, but now if you look at this, you might be confused because you're saying, "Wait a minute, if more cytokines are recruiting more immune cells, how could that be a bad thing? Wouldn't we want more soldiers to fight off the infection? How could that be a bad thing, right? If you're thinking that, that's really good. But you have to think of it in this way. Think of it, the difference is somewhat like the police and the military, or a police action versus total war. Okay, I think all of us would agree that when there's a police action, so when the police are involved in some type of incident, there might be some collateral damage, but not that much, right? Whereas when there's total war, everyone would agree that there's going to be tons and tons of collateral damage. Bombs are going, tanks, and just a lot of collateral damage. There's could be a lot of innocent people, innocent just buildings are destroyed, right? There's gonna be just a lot of damage. Whereas when police are involved, the damage is not as great. Okay, so when the police are involved, there might be some things that are damaged, and sadly enough, some people may lose their lives. Maybe even innocent people might lose their lives. But when you compare it to, for example, total war, it's I mean, total war is just there's a lot of collateral damage. In this, it's kind of that cytokine storm is kind of like that. Okay, when we have a over response, a hyper response from the immune system, you're going to get a lot of collateral damage in your body, especially in your lungs. And that is going to drive people towards death. Does it make sense? So you got a lot of damage happening in your lungs because of a hyper inflammation and over response from your immune system, which is going to cause death to your cells, then fibrosis, liquid building up, and then people have a difficult time breathing, and eventually they die. So you understand. So you can see here that yes, the virus is the initiating factor, but it's the response to the virus that ultimately determines in many cases whether someone's going to live or someone's going to die. And an over response can result in death. Okay, that's cytokine storm. Okay, so then, sorry, what can drive someone towards cytokine storm? Okay, well, Dr. Yu writes, chronic metabolic disorders, obesity, type 2 diabetes, and cardiovascular diseases are associated with immunometabolism dysregulation and chronic systemic inflammation. The malfunction of immune system and chronic inflammation escalates and prolongs the hyperinflammation in COVID-19 disease. Okay, so basically what he's saying is that when people have obesity, heart disease, diabetes, that their bodies are in a state of inflammation already, and then when you add COVID into the picture, then it just blows things up. That's basically what he's saying. Okay, and I believe he is correct. Okay. In view of this, the author proposes that curing the pre-existing health conditions should greatly lower the mortality of the elderly and the overall death rate of COVID-19. So basically, it's something like this, okay? If you get infected with COVID, so this is the virus, several things can happen. You might have, some inflammation and you might just recover. You might have, moderate amounts of inflammation, so you might get somewhat sick, but then you recover. But then there's a small group of people who are getting lots of inflammation and then they die. Okay. Now, when people have a chronic disease already, even before they get infected, they already have their bodies are already in a state of inflammation. Okay, so you see the fire, there's already inflammation happening in the body. So then when you add the virus, it just really could potentially blow things up. The chances of that is greater. So you see, the probability, the chance that you reach a level of hyperinflammation is increased when we already have inflammation happening in our body due to these chronic diseases. Okay, I hope this is making sense. All right, so you can see here already that addressing these chronic diseases then should be something that we should really be emphasizing as we're going through this pandemic as a society and as individuals. If we have people who have these chronic diseases, uh, really, we need to be addressing those diseases as well as talking about how to handle the virus itself. Okay, if we're just talking about one and not the other, I think we're really missing the boat here. All right. So, for example, obesity. Okay, when someone is leaner, they have less fat cells, and fat cells release inflammatory cytokines. They release those messengers, right? But so someone who is lean, has less fat cells, and so less of that cytokine release. However, when someone has excess fat, they have a lot of fat cells, and those fat cells are very metabolically active. They release pro-inflammatory cytokines, right? So what happens is you basically gonna get more cytokine storm, or the greater possibility of getting to cytokine storm, because you see here the virus is infecting a cell and you see these green things. These are cytokines, right? So the cells are releasing cytokines to try to activate immune cells. But you see here, there's these red cytokines, right? That's from the fat cells. So basically what this paper here is illustrating is that when you have the virus causing cells to release cytokines, and then you have excess amount of fat cells also releasing cytokines at the same time, then you got, what do you get? Cytokine storm. You see? So this can show you how something like obesity can indeed increase the risk of going towards cytokine storm and death from COVID-19. And this is indeed what we are seeing, that obese individuals are at greater risk of progressing towards death due to COVID-19. Whereas if someone is leaner, generally speaking, they're less at risk compared to obese individuals. All right. So, for example, this was looking at thousands of individuals in New York. You remember the pandemic was quite severe in New York, and they looked at people who had severe COVID-19, who had to be admitted to ICU and stuff like that. And they saw, the vast majority of them, or at least a significant majority of them, had either morbid obesity, they're like very, very obese, or they're obese. All right. So this is well documented in the literature. All right. Obese individuals have a greater risk of needing to be put on a ventilator. People with more visceral fat, so that's the fat on your organs, have a greater tendency to be admitted to the emergency department. Okay, this is a study from Rome and so forth. So obesity is a significant factor. The COVID pandemic converges with the obesity pandemic to create a syndemic. All right. The first pandemic of the 21st century uncovered the sinister relationship between obesity and morbidity upon viral infection. Today, COVID-19 has exploited our increasingly obese world in its global spread. So COVID-19 is taking advantage of our increasingly obese population to cause the destruction that it is causing. Okay. Now let's look at diabetes. Depending on the global region, 20 to 50% of patients in the corona disease 2019 pandemic had diabetes. Okay. The risk of fatal outcome from COVID-19 is up to 50% higher in patients with diabetes than in those who do not have diabetes, up to 50% higher. Okay. Why? Again, it's the same thing. When people have high amounts of blood sugar, high amounts of sugar in their blood, it could interact with infection from COVID to drive cytokine storm. Okay, type 2 diabetes is a state of excess inflammation, chronic inflammation. Okay, so and this goes for hypertension, this goes for cardiovascular disease, and so forth. Okay, the vast majority of immune systems without medications or vaccines, by the way, can adequately deal with with SARS-CoV-2. Okay, that's the virus that causes COVID-19. But if burdened with chronic diseases, even a defeatable disease becomes undefeatable. Okay, so you can think of it this way. This guy here is carrying this weight. He's doing like a shoulder press or a military press, and he's able to do it very easily. Okay, it is not a problem. This weight is not a problem for him. Okay, but imagine you chopped off one of his arms. Okay, now a weight that he was able to easily lift all of a sudden becomes very difficult for him to lift. Okay, this is kind of what we're seeing, at least in many cases. I would say the majority of cases with the coronavirus pandemic, that a virus that has been clearly shown that humans can indeed defeat, but in a certain certain groups of the population, we're seeing that they're not able to defeat it, and many times it's because their bodies are debilitated with these chronic diseases. Okay, so the question is, if diabetes, obesity, heart disease, if these chronic diseases are contributing to severe and mortal COVID, then we have to ask ourselves the question, what contributes to these diseases? Okay. And of course, I hope we all know the answer. It is lifestyle. Okay. Poor lifestyle habits drives chronic disease, which in turn will increase our risk of getting severe and mortal COVID-19s. Poor nutrition, sedentary behavior, improper sleep habits, uh, drinking alcohol, at least too much, that type of a thing. Okay, so let's take a look at some of these things. Okay, now I just want to be very clear. We're not saying that if you eat more salad that you're going to prevent yourself from getting infected. Okay, no amount of salad, no amount of sleep is going to prevent a virus getting into you. Okay, this is why physical distancing and masking and whatever that kind of stuff is important. Okay, but what we are saying though is that if we are living healthy and therefore having a healthy immune system, that it might help us not get severe COVID. I think that's what we are really saying here. Okay, so let's be clear. We're not saying that eating more salad is going to prevent you from getting infected, but we are saying that it might help you handle once you are infected. Okay, so let's take a look. I want to propose to you some lifestyle habits, all right, that I think all of us should and can start implementing starting today. Number one, whole foods, plant-based nutrition. Okay, so the reason why I say that is because whole foods, plant-based nutrition has been shown to have an anti-inflammatory effect on the body. Remember, COVID-19 is hyperinflammation. So you want to have inflammatory effect on the body, and plant-based nutrition can do that. But more importantly, whole foods plant-based nutrition has been shown to greatly lower the risk of getting diabetes, heart disease, and obesity. And also, if you already have those diseases, whole foods plant-based nutrition has been shown to be able to help people heal from those diseases. In fact, if you get somebody who has coronary artery disease, blockage in the heart, you could literally see it open up again by switching them on a plant-based diet. Same with type 2 diabetes. You can actually reverse type 2 diabetes potentially uh, by switching people on to whole foods plant-based nutrition. Okay, so I want to encourage people to really eat healthier, okay, and in a more plant-based direction, and whole foods. That means less processed. Okay, exercise, right? It's very sad that people got, at least some people got the impression that they had to just stay at home and not go outside. I think that is a travesty. All right, we need to be exercising. All right, when the pandemic started, uh, the American College of Sports Medicine, at least several months later, but they released a statement. All right, and the American College of Sports Medicine is one of the leading exercise science bodies in the world. The leading exercise scientists in America are many of them are part of this College of Sports Medicine. Okay, and they released a kind of like a call to action or position statement. Look what they say here. During this pandemic, it is essential for those with normal health and chronic disease to activate, maintain, and advance physical activity to 30 to 60 minutes most days of the week within the confines of social distancing. Okay. So I'm not quoting conspiracy theorists here. We're talking about one of the most reputable exercise science bodies in the world releasing a statement saying, yep, we should be exercising. Okay, we're not supposed to just staying at home, binging on Netflix, and playing video games all day long. We should be getting out and exercising. All right. Exercise does amazing things for your body. It increases the number of all your immune cells by several fold. So, for example, your CD8 T cells can increase by threefold. Your natural killer cells can actually increase by up to tenfold. Okay, with exercise. Okay, exercise has been shown to shunt immune cells towards specific parts of your body, particularly the gut and the lungs. Now that's fascinating, isn't it? Because we know that the virus infects or can affect the gut and it affects the lungs. So interestingly enough, when we exercise, science has shown that your immune system recruits immune cells and then it ships them off to the gut and to the lungs, which I think is very fascinating, right? So I think we're amazingly designed to really benefit from exercise in that way. And I think that's really, really important. So I think this shows you why we should be exercising. Okay, it's really even more important now. Now, some of you might be saying, well, I thought we just said that recruiting more immune cells isn't good. So if exercise recruits more immune cells, then wouldn't that just put me more towards cytokine storm? Wouldn't that be bad? Right? So we're saying that, the virus can really cause the release of cytokines and you get a lot of immune cells. So if exercise is also doing the same thing, and then wouldn't we just end up getting cytokine storm? Okay. So wouldn't exercise be a bad thing? Well, not exactly. Okay. Exercise induces a cascade of events, mostly favorable, leveraging the immune system via an ultimately anti-inflammatory pattern. Okay. So whereas chronic diseases puts you in a state of hyperinflammation or increase the risk of hyperinflammation, exercise indeed does stimulate the immune system, but you can see it as a more regulated response, which is exactly what we want. Okay, so it's kind of like, if you want to deal with criminals, you could send in a bunch of Rambos, or you can send in the SWAT team. Okay, a bunch of Rambos are going to they might get the job done, but they're going to cause a lot of collateral damage. right? Whereas the SWAT team is going to be much more coordinated, much more regulated, right? So exercise is kind of like that. You can see it as kind of you're recruiting the SWAT team, all right? So exercise indeed does release more cytokines, but also helps to release cytokines that can have a regulating effect as well. So I still think exercise is extremely critical at this time. Okay, let's look at smoking. Okay. Studies have shown that smoking is associated with the prognosis of COVID-19 infection, and current and former smoking is significantly associated with the risk of serious illness from COVID-19. Okay, so if you look at the literature, there's kind of conflicting evidence. Some papers are saying that that smoking can increase the risk of severe COVID, whereas other papers are saying that it doesn't. I would personally err on the side of caution. And to be honest with you, I think that it kind of makes sense that smoking probably isn't a good idea when you're dealing with mainly a lung issue like COVID. All right, smoking has been shown to cause the release of cytokines, inflammation in the body. Okay, smoking also increased the numbers of ACE2 receptors. So the virus here uses what's called the ACE receptor to enter into your cells, to infect your cells. Smokers have been shown to increase the number. Smoking has been shown to increase the number of ACE receptors, therefore making the possibility of infection, at least infection into your cells, much greater. Okay, and of course, when smokers are, they're coughing, they might be releasing, infected droplets and so forth. And often smokers, they smoke together, right? They smoke in groups, which can also, there's obviously that issue there too, right? So I believe that, our leaders should be really making a clarion call to the population to really go towards the direction of just completely stopping smoking altogether. Okay. How about alcohol? It is appropriate to inform the population that consumption of alcoholic beverages, especially risky or harmful consumption, correlates with a greater probability of viral lung infection. Therefore, in a historical period characterized by a COVID-19 pandemic, doctors and all health professionals must motivate citizens not to consume alcohol or limit consumption to more than one alcoholic unit per day. This is especially true in the elderly population with polypathology, as in, they have other diseases, and polytherapy, basically like on multiple drugs. So this is a researcher from Italy, I believe. And he's writing about the COVID-19 pandemic and alcohol. And he's saying, it might be a good idea to actually to tell people to actually stop drinking or to greatly limit. Unfortunately, there are papers that are being released about the pandemic saying that there's some evidence that drinking actually has gone up. And I believe that it's really sad that we have closed down, certain businesses, but then we left beer stores open as if beer stores are essential. I think that's quite ludicrous in my opinion. Alcohol has been shown to increase ACE receptors. All right, so again, the virus uses the ACE receptor to enter into cells. Okay, alcohol use has been shown to increase ACE receptors. All right. Also, alcohol contributes to something called leaky gut. All right. So you see here, right here, you see the gut cells are very tightly packed together, so nothing can get through. When someone has leaky gut, it's like the walls are breaking apart. So you see the walls are kind of like breaking apart. You see it's kind of leaky and stuff is getting through. When that happens, it can cause inflammation in the body, chronic inflammation. Well, alcohol causes that. And we know that COVID-19, or sorry, the SARS-CoV-2 virus can infect the gut, right? And people are getting gut issues. And we know that hyperinflammation is an issue. So why would we want to do something that could potentially promote inflammation in our bodies, right? I don't think that really makes sense. I believe that really the best thing to do is to just completely abstain from alcohol altogether. That is my view. How about sleep? A single night of sleep deprivation can produce significant mood disturbances and lower immune defenses. We all know this, right? That lack of sleep suppresses your immune system. All right. So we need a population that is getting adequate sleep at this time. And it's unfortunate that papers are coming out about this pandemic in the peer-reviewed literature, suggesting that that there's high levels of sleep disturbance and irregular sleep. Okay, lack of sleep has been shown to decrease the number of T cells and promote increased release of cytokines that can promote inflammation. Okay, so I want to encourage everyone to get enough sleep. Okay, sunlight. All right, this is me and my wife and my child, and every day we've been going out to get sunlight. All right, is sunlight beneficial? All right, it is possible that the cascade of anti-inflammatory mediators produced in response to exposure to UV light, including nitric oxide and vitamin D, may act in concert to potentially prevent the COVID-19 cytokine storm and induced inflammation. So what they're saying is that UV light exposure may potentially lower the risk of potentially going towards cytokine storm. Okay, these are researchers writing in peer-reviewed scientific journals. All right, these aren't like conspiracy theorists. Okay, indeed, exposure to UV light and such induced mediators may reduce circulating pro-inflammatory cytokines linked to COVID-19 cytokine storm. Okay, so basically what they're saying is that when you get sunlight, it helps to form it helps the conversion of vitamin D, and vitamin D has powerful effects on the immune system. It's an immunomodulator. It's really critical for the immune system. So, and of course, we don't get vitamin D directly from the sun, but the sun helps with the conversion, right, of vitamin D. So really, I think people really should be getting out and getting out in the sun so that we can optimize our levels of vitamin D. All right. Moving on here. Yeah, let's skip this. Now, are there lessons from prior vaccines? So right now, um, we are trying to massively vaccinate the population. Okay, but um, can help being healthy help with even that process of vaccination. Okay, this is Gregory Poland. All right, Dr. Poland, and he is the head of vaccine research at the Mayo Clinic. This guy is 100% pro-vaccine. He's not anti-vaccine. He's 100% pro-vaccine. But he wrote a paper a few years ago that I think would be very enlightening to all of us, and I think highlights why being healthy already is important, even during the process, or even to optimize the effect of vaccines. Okay, so take a look at this. He writes here, this is 2018. Vaccines are much like seatbelts or airbags in cars. Maximum protection against injury or death occurs when they are used properly and in the right setting. But they are no guarantee of absolute protection and safety. So notice here, he's saying vaccines are not a guarantee. Okay, they must be used correctly and in the right setting. So what do you mean, Dr. Poland? Well, he continues. Optimal vaccine immunogenicity, so basically saying, making vaccines optimally effective, occurs when the host, that means the human, us, is healthy with highly functioning innate adaptive humoral and cellular immune systems intact. Immunocompromising medical conditions like diabetes, obesity, and so forth, and their associated therapies can lead to insufficient or absent immune responses to vaccines. So basically what he's saying is very simple. He's saying vaccines are not a guarantee. To optimize the effectiveness of vaccines, the person, him or herself, needs to have an optimally functioning immune system to really optimize the vaccine. Okay. Now he's not saying that that a diabetic individual or that someone with heart disease cannot benefit from a vaccine. That's not what he's saying. But we know that vaccine failure is very real. especially in the elderly. Vaccine failure is very real. Okay, and that's because in the elderly and people with diseases, their immune systems are already suppressed. Okay, and so that can limit the effectiveness of vaccines. So basically, what he's saying here is that having a healthy host, having a healthy individual, optimizes the effectiveness of vaccines. And I think it's very unfortunate that we're not telling people this as we're trying to ramp up vaccinations. I think if we're going to try to ramp up vaccinations, I think we should try to help people to also be in a state where they can maximize the effectiveness of those vaccinations. I think, I don't know about you, but I think that just makes sense to me. Okay. Now, I want to show you, kind of helps, this illustration will help you kind of understand why that's the case. Okay. So imagine this is a vaccine. So this is like a weakened virus, let's say. Okay. And you can see here, when they inject someone with a virus, or sorry, someone with the vaccine, the you want to create antibodies, right? So in order to do that, a whole cascade of events needs to occur. You see this? So your immune cells get activated, and then it forms plasma cells and it forms antibodies. Okay. At the same time, also the vaccine wants to stimulate T cells as well. Okay. So you can see here, the brunt of the work is not done by the vaccine. It is done by the immune system. Do you guys see that? The vaccine is very passive. The immune system is the active component. All right. So you can see here why Dr. Polland is saying that you need to have a good immune system to optimize the effectiveness of the vaccine, because as you can see here, the immune system is actually what's doing the heavy lifting, right? The vaccine relies completely on the human immune system. In fact, the immune system is the main primary and critical player. Okay. And what do you need to do to have a healthy immune system? Avoid chronic diseases, being healthy. All right. And how do you do that? Eating right, exercising, sleeping, that type of thing. Okay. Now, I just want to just close off with a few closing thoughts here. Okay. First is healthy lifestyle is not a guarantee, and that is correct. Okay. You can be healthy and you can still even die from COVID-19. That is correct. But it is still critical and essential. Okay. So, uh, because there's right now in the media, they're saying, oh, even if you're healthy, you can die and so forth. Yeah, that's true. Okay. But that doesn't negate the importance of living healthy. Okay. It's still critical and essential. All right. So, for example, are ventilators perfect at what they do? No. Are masks perfect? No. In fact, did you know that the majority of people put on ventilators actually end up dying? All right. But doesn't mean that ventilators aren't useful anymore. No, they're still essential, right? So even though it's not perfect, it's still essential, right? So how about lifestyle? Is lifestyle a perfect solution? No, but still essential. You see, so I don't want individuals to just kind of like write off living healthy because somehow there are still healthy people who are dying. Well, no, it's still critical. Okay, it's both and, not either or. So what we're saying is not, it's not, either distancing and masks and vaccines, and not this. Like we're not saying it's this, or we're not saying it's this and just forget about this. That's not what we're saying at all. We're saying it's both this and this. Okay. Unfortunately, the public is not. It's not being emphasized to the public that it is both and. What we're being told is just, it's the impression that we're getting. It's only this and not this. It's only this. I think that is really uh if you want to be scientific, I don't think actually that really that's the case. I think it's this and this. Okay, one does not exclude the other. Okay, young and healthy people can be seriously affected by COVID. Absolutely. Does it negate the overwhelming pattern? Not even close. Because right now they're talking about, healthy young people, younger people are are starting to get more serious COVID, but that in no way negates the overwhelming pattern that we're seeing. sometimes the impression, it seems like, the risk is now the same for young and older people. That's the kind of like the impression that you might get. That is absolutely not the case. All right. This is from the Ontario government website data just yesterday. You can see the overwhelming majority of deaths are from those who are elderly. Okay, there's under 20 is only 2 deaths for those under 20. For the 20-year-olds, it's 14 deaths out of over 80,000 infections. The vast majority of them have recovered. Okay, so you can see, yes, young people can die, absolutely. Okay, but don't tell me that, or don't give the impression that somehow the risk is the same. Okay, it is not. Okay, and the reason is simple. Younger people tend to have a healthier immune system. Okay, why are they surviving? It's because their immune system mounted a sufficient response. They didn't get to cytokine storm. All right. Now I'm just gonna close off here, um, and just answer the question: does this even matter anymore? So you're thinking like, so living healthy, eating right, and exercising and sleeping, does it even matter anymore? We're kind of, we're a year and a bit into the pandemic, and the vaccines are out, and does this even matter anymore? Okay. This is Dr. Ryan, and he's one of the directors of the World Health Organization. At a news conference, I think he shared some information that I think should be a major warning for all of us. He said, I'll say one thing that will come as a shock to people. This, talk about COVID-19, is not necessarily the big one. This virus is very transmissible and it kills people, but its current case fatality is reasonably low in comparison to other emerging diseases. So what is he saying? He's saying this pandemic is actually not necessarily the big one. There's a bigger one coming. That's essentially what he's saying. Okay? This is a wake-up call. These threats will continue. Okay. We need to get our act together. We need to get ready for something that may be even more severe in the future. In this, we must honor those we've lost by getting better at what we do every day. So basically, Dr. Ryan is saying COVID-19 is bad, but it's actually not the baddest one. There's a more severe, a more transmissible infection coming. That's what he's saying. He's saying, and we need to get ready. Okay, and unfortunately, I think what our authorities are gonna go to is they're gonna depend on like vaccines, right? But think about it. Once we got once the pandemic started, it took many months before the vaccine to come out. Within that time, there was over 2 million deaths, many people died. Okay, so if we're just gonna rely on a vaccine in the future for another new virus that comes along, there's gonna be many people that are gonna die. Okay? So are vaccines important? Yes, right? But if there's a bigger, badder virus coming, then you can easily see here that you can't just wait around for a vaccine. Okay. It's kind of like in World War II, the Americans were secretly developing the atomic bomb. Okay. The generals, the American government, they knew that the bomb was coming, the big guy was coming, the big weapon. But in the meantime, you still have to fight the Japanese, right? You can't just sit around and just say, well, the atomic bomb is coming, so let's just wait around, right? You're gonna die. Okay, so what do the Americans have to do? Until the atomic bomb showed up, they had to fight. Okay, so basically what I'm saying today is that before the vaccine shows up, so like let's say we get hit by a new virus, well, they're gonna start madly try to produce a vaccine. Okay, but that's going to take months and months, right? So in that meantime, if indeed we're facing a more severe and more transmissible, more stronger virus, then uh, doesn't it make it even more critical that we start to develop a healthy immune system now, because we still need to fight in the meantime, right? And what's the only thing that you have left to fight with is your own immune system, and the only way to do that is to be healthy. Okay, I hope that makes sense. This is just simply saying that other pandemics have shown that obesity, diabetes, and so forth have been associated with severe forms of those diseases. Okay. So I was going to conclude here, Daniel, and just say that I believe that we need lifestyle medicine, and that it needs to be a bigger part of the conversation. We're not saying that it's either or. We're saying that it's both and. And I think that it's also not to um, overly criticize our leaders as well, because you know I don't think any of us is going to sit here and pretend like we could have done a better job than these guys. They were faced with a very, very difficult situation, making very, very difficult decisions. All right, so I think they're trying to do the best they can, but I think that individually, each one of us understanding what the science says about the potential for these lifestyle habits to be protective, to benefit each one of us, I think we as individuals can start practicing these healthy lifestyle habits, right? That's what I want to encourage everyone here to do.
All right. Well, thank you, Dr. Cho, for a really informative and enlightening presentation here. We just have a few minutes for questions. So if you do have a question, please put them in the chat box. We can't take too many